Hello. Today we would like to talk to you about the medical record system in the United States. Healthcare industry is bleeding time and money because of fragmented health records. It leads to duplicate testing, dangerous drug interactions, and massive administrative waste. The technology to fix this crisis exists, but it hasn't been unified until now. To start, let's look at the core job our customers, medical health providers, are trying to get done. Their goal is simple, but difficult to achieve. They need to walk into an examination room with a complete, accurate, timely patient health information. Currently, this process is broken. Solutions are fragmented, forcing providers to use manual workarounds to piece together the patient story. Our solution fixes this by providing a consolidated, streamlined view of medical info, prescriptions, and test results, allowing the provider to focus on care rather than data gathering. Why is this necessary? Because the current circumstance is one of struggle. The management of medical records right now is incomplete and requires heavy manual intervention. When a provider cannot locate medical information in a timely fashion, it ruins the provider patient experience. Even worse, inconsistent records and variations in charting lead to serious clinical risks, including misdiagnosis, delays, and unnecessary duplicate testing. Before developing the system, we validated this opportunity through a low-cost, low-risk concierge experiment. We developed a team to manually act as a software, collecting and organizing visit notes, lab results, and test results. We then timed medical providers to see exactly how long it takes them to review medical information when it's organized versus when it's not. We followed up with interviews to better understand the qualitative experience as well. Our solution is a unified, cloud-based electronic health record system. It solves the fragmentation problem through standardized data formatting and an AI-powered search function that instantly pulls and organizes relevant information. This isn't just for doctors. It's an integrated platform connecting medical care to insurance providers. We also include a patient-facing mobile application, putting medical history directly at the fingertips of each patient. So how does this eliminate the struggle we identified earlier? First, it provides a single consolidated view, meaning providers stop chasing info across different portals. Second, our system auto-imports and digitizes facts, PDFs, and handwritten notes, drastically reducing manual entry. Third, real-time data syncing eliminates communication delays. Finally, we offer a transparent insurance dashboard, which reduces patient confusion and relieves staff from the burden of explaining benefits. To validate our go-to-market strategy, we are launching a targeted experience. We will host an explainer video on a dedicated landing page and drive traffic to it via LinkedIn advertisements and targeting medical providers and hospital administrative staff. We are also conducting direct outreach to local clinics. We will measure success by tracking page visits, video engagement, and most importantly, the conversion rates of visitors signing up for the trials. The gains from these solutions are measurable and significant. Higher efficiencies translate immediately to lower administrative costs and less work duplication. Faster preparation time means doctors spend their time treating patients, not doing paperwork. For the patient, they gain transparency and access to their full history. Ultimately, we achieve improved collaboration by hosting a facilities on a single unified platform. Our business model relies on a subscription-based approach to ensure predictable, consistent revenue stream. We are leveraging an ecosystem model that connects EHR vendors, insurance companies, medical labs, and care providers. Because we serve a multi-sided market, patients, providers, and payers, our platform becomes more valuable as more users join the network. Financially, our revenue structure is driven by monthly subscription fees, supplemented by initial licensing and transaction fees for insurance verification. We offer tiered services to cater to different facility sizes. On the cost side, our primary initial expenditures are software development and cloud integration. Ongoing cost includes cloud subscriptions, HIPAA compliance management, and sales and marketing efforts to onboard new customers. To execute this vision, we are seeking to raise $1.5 million. We plan to allocate 40%, or $600,000, directly to product development and to build the core platform. 30% will go towards sales and marketing to drive adoption. 20% is allocated for staffing and hiring key talent, and the remaining 10% will be used for continuing research and development.
Our integrated electronic health record system offers a significant value advantage. Market research resulted in a differential value of 415.32, indicating customers consider our solution to be a substantially better fit than the next best solution. Our system performed exceptionally well during the research phase, delivering superior performance across all measured attributes. Additionally, our high utility score of over 207 indicates customers highly value our features, specifically the quick appointment access and fast data synchronization. We believe that our integrated electronic health record system is the best value among competing alternatives. Further market research supports this claim. We experienced an overwhelmingly positive market reaction and predicted market share of over 65%. Customers value our price and data integration scope. Our system offers such a significant value that customers are willing to switch from their current solution in use to our system. The integrated electronic health record system is innovative, offering both patients and medical professionals complete and accurate medical history. Patients want accessible records and access to their lab work, doctor's notes, and insurance details all in one place. Existing systems are sluggish and lacking integration between medical facilities, insurance companies, and patient portals. There is also a considerable push to adopt our new electronic health record system. Old systems are time-consuming as staff locate the latest patient records. Medical support staff are often overworked and waste valuable time tracking down medical histories. There are long wait times and records are transferred, and the information received is often disjointed. Inconsistent record keeping leads to repeated testing, and varying interpretation methods can result in miscommunication between medical professionals. Finally, ambiguous billing and insurance details leave patients frustrated and confused. There is also pull to adopt our integrated system. Our electronic records system offers unified cloud-based electronic health records, integrated record-sharing platforms, an AI-powered medical record search tool, alerts for missing or incomplete patient labs, and transparent insurance and billing platforms. We are fulfilling the value proposition by offering a unified electronic health record platform with real-time standardized record sharing. Our system offers seamless integration between practitioners, patients, and insurance companies. We offer AI-powered search tools to help streamline record lookup and note-taking, and our system provides a consolidated and accurate patient history. Patients appreciate the cost transparency and integrated insurance details, and our system has been proven to reduce the duplication of tests, decrease administrative burden, and improve patient trust and empowerment. Our system also offers social and societal benefit. The online nature of our electronic health record system reduces paper waste at medical facilities and eliminates redundant lab tests and imaging studies, thereby conserving physical materials, chemicals, and electricity. Our system offers cost benefits via favorable shareholder and customer opinions. Our system simultaneously improves integrated electronic health record while improving financial performance, environmental responsibility, and provides equitable access without imposing a prohibitive cost burden on customers. Our system is also innovative. It's a unique and consolidated online system that simplifies patient record access via seamless data exchange between different hospitals, specialists, insurance companies, and medical laboratories. Our system also encourages human equity by ensuring medical records are available to rural, low-income, and marginalized patients. The electronic health record system offers access to medical details for all patients, regardless of circumstance. Clinicians are able to make faster and safer decisions with complete patient histories. Finally, patient accessibility is empowering and breaks down administrative barriers that have caused problems in the past. The combination of overwhelmingly positive market research, the quality and innovation of our system, and the environmental and social benefit to our system all support our belief that the integrated electronic health record system is the best value among competing alternatives.
Now that we've demonstrated the value proposition, demand validation, and business model for our unified EHR, the final question stakeholders will naturally ask is whether the solution is ready for execution. This next section highlights the ecosystem risks that could affect delivery and adoption, and the mitigation strategies that we've put in place to address them. The goal is to provide confidence that we understand the landscape and are fully prepared for successful implementation. Our solution exists within a complex healthcare ecosystem. It involves medical providers, EHR vendors, cloud service providers, labs, insurance companies, regulators, and patients, along with medical equipment and IT service partners. Because each of these entities interacts with the system in different ways, risks can arise from multiple directions. Understanding these interdependencies helps us to proactively manage the areas that could influence adoption, compliance, or operational performance. These are the primary risks associated with the technology and regulatory environment. There's a possibility that vendor software may not integrate fully, or that inconsistent data formats could cause compatibility issues. Limited API support can slow development. Cloud-based systems introduce risks around uptime, security, and data availability. Additionally, regulatory requirements, particularly HIPAA updates or certification changes coming from both the state and federal levels, can shift and change rapidly. If we are not aligned with these updates, our product could face delays or require costly rework and put us behind. The next category involves adoption-related risks, or essentially the factors that influence whether customers can and will use the system. Healthcare providers may be hesitant to adopt systems that disrupt their workflows, and as a nurse myself, I can definitely attest to that, having had to adopt new workflows that temporarily made my job feel more cumbersome, difficult, and slowed me down when I felt that that was not the priority that I needed to focus on. Other adoption risks include medical equipment or existing systems that may not integrate seamlessly. Labs may worry about revenue reductions from fewer duplicate tests. Insurance companies may struggle with software alignment or may not welcome increased pricing transparency. And finally, hospitals often face huge budget constraints, and especially right now with the healthcare and economic landscape being tight and uncertain, high upfront implementation costs can absolutely become barriers. To address the technology and regulatory risks, we have designed our solution to be secure, standards-driven, and resilient. We will build a strong internal integration team to manage complex connections with vendors. The platform will follow established healthcare data standards such as FHIR and HL7, which reduces compatibility issues and protects us against regulatory changes. A multi-cloud, multi-zone architecture minimizes downtime and ensures continued service so patient care remains seamless and uninterrupted by downtime gaps. And third-party cybersecurity audits provide an additional layer of verification that our system meets compliance and security expectations. Our approach to adoption risk focuses on reducing friction for customers and lowering operational barriers. We will offer an optional onboarding support package to reduce the strain of implementation. Training materials include videos and tutorials and step-by-step workflows and algorithms that can be easily tailored to each facility's needs and standards and are included in the subscription to keep learning simple, flexible, and individualized. Tiered integration levels allow organizations to start with a very basic setup and expand as needed, which helps them manage cost and complexity and grow as their organization continues to grow at their own scale. Partnerships with medical technology companies ensure that our solution integrates with equipment much more seamlessly. And transparent pricing helps both insurers and providers feel confident about the financial implications. All of these mitigation strategies do more than just reduce risk. They also enhance the customer experience and reinforce demand. Lower switching friction encourages providers to adopt the system more quickly. Immediate efficiency gains reduce administrative time and eliminate unnecessary testing, creating a rapid return on investment. Insurers benefit financially from reduced duplication and improved accuracy. Providers gain smoother workflows and more complete patient information. And patients also benefit hugely from greater transparency and access ease. Together, these factors support the strong market share potential identified in our earlier analysis. In summary, we have thoroughly evaluated the ecosystem risks and implemented strategies to address them across the technology, regulatory, and adoption dimensions. By building a standards-aligned, secure, and highly adoptable solution, we are now entering the execution phase with a clear and manageable risk profile. This positions our unified EHR solution as not only high value and high demand, but also structurally prepared for launch. We thank you very much for your time and appreciate the attention and consideration to our presentation and our EHR value proposition. Thank you very much.